Hello, my name's Claire Tune. I'm the lead counsellor here at Phyllis Tuckwell Hospice Care. So I think the most important thing about supporting children through difficult situations such as a serious life illness is being open and honest with them. Even small children, very, very young children, toddlers, actually can pick up when there's something going on in the family. They can tell the difference in how people are reacting to one another and atmospheres in the home. And these things can often escalate for them. Their thoughts can sort of become quite irrational, and that can instill a great sense of fear in them. And the way to avoid that is actually to sit them down quietly, somewhere comfortable, where all of you feel comfortable together, and just gently explain to them that mummy or daddy isn't very well at the moment. How much detail you tell them at that point is very much dependent on their age and their ability to understand this information. So obviously younger children's understanding will be far less than older children's. Helping children understand the things that may happen during a person's illness is really important, so as to prepare them and for them not to be scared. If you're able to talk to them and help them know what's going to be coming, they can deal with it in a much better way. Things like weight loss or even weight gain, where physical appearance can change quite dramatically. Hair loss can be another very obvious change. Sickness also, where they may be receiving treatment, and that might mean long periods of time in bed. They're no longer able to get up and do school runs or take part in activities they may have done once before, playing football, just generally going out and about and being part of the family, perhaps sitting down and having family meals together. Things like that can change. And it's really important that children understand that this is all part of the process and it's not something for them to become overly anxious about. What we describe as puddle jumping is where we see children becoming very upset and distressed, and then in one moment and then in the next moment they're running off down the garden, jumping on the swings and playing quite happily. It's perfectly normal behaviour. This is how children process the information. So don't be alarmed if you think that your child perhaps isn't reacting to what you're telling them or is perhaps overreacting to what you're telling them. Just be there, be a constant reassurance for them in their life that what's happening and what they're experiencing is okay. And encourage communication all the time. Tell them that if they want to come and talk to you, if they have any questions, they can come and ask you. And it's okay for you to say, actually, I don't know the answer to that. It's a really interesting question. I'll go and see if I can find out. The important thing about talking to children as well is to make sure that they all know the same information. That can be quite challenging when you have children of varying ages and developmental stages as well. So their ability to understand information may be greater or lesser than their siblings. It's helpful if you can all sit down together and talk together using language that perhaps the younger of the children will understand. So that it's not beyond their reach to hear what's being said, to understand the words that you're using, and encourage them to ask questions. It may be that older children will want to ask more complex questions, and that's okay if you can then try and help the younger children perhaps understand what their sibling is asking in perhaps simpler language. It's also really important to use the correct words. Routines can sometimes change, and whilst they are important for children, it's always helpful if you can try and manage their expectations around how things might change. So for example, picking up from school or even dropping off to school, it may not be you anymore, it may be someone else, it may be a family friend. And if you can help them understand the reasons for that, and also let them know who's going to be picking them up and on what days, perhaps, and reinforcing that on the day as well. So they have an expectation of what's going to be happening to them and where they're going to be going, what time you might be coming back to pick them up. Helps them manage their emotions, and it instills a sense of control and calmness for them as well. How we model our behaviour to our children is very key. For our children to be able to express themselves, they need to be able to see us expressing ourselves as well. So that might be you, the parents or the grandparents, and other adults around them who are quite key to their care. It's okay for us to be emotional and to shed a tear and to say to our children, I'm feeling really sad because in that way we are modelling to them and showing them that actually it's really okay to have these emotions and not to bottle them up. Bottling them up can actually cause a lot of illness in us, depression, and it can make it very hard for us to communicate with one another, which is quite key as we actually develop and become mature adults. Even though a child might not be in the room with you at the time when you're having a conversation with someone else, very often they can be around and about in the house and they do pick up on conversations and they hear bits and pieces. And actually that can be very detrimental to a child if you're trying to hide things from them, because they will hear one part, not the rest, and that can escalate in their minds and again, instill great fear in them. And often if you're not talking to them about it, they won't be talking to you about it. So that information will be growing in their minds and they won't be sharing it. And that can actually cause them to become very low in mood, perhaps even depressed. And it can also cause, other issues such as, sleeping problems and things like that. So really important, communication all the time. You don't want your child to be hearing about your illness from another child in the school playground, and that can happen. Always explain to children what they can expect to be happening. Also helps manage their expectations and support them through a process. So for example, if you're going to be taking a child into hospital to see a sick relative, to help them understand what they can expect to see. What's the environment going to be like? Is it a room with a person on their own? Is it going to be a ward? What's it going to look like? What's it going to smell like? What might be happening in there? There might be other people coming and going. What might those people be doing? Some might be visiting, some might be doctors and nurses. To help them understand exactly what they can expect to see and experience is really, really important. They can then make a choice as to whether or not they feel able to go into that environment. It's also really important children have choice. It's very unhelpful to force a child into a situation that they really don't feel comfortable in, and that will be quite damaging for them and they will remember that forever. So allowing them to have that choice, an informed choice, and telling them that if they want to change their mind at any point, that's absolutely okay, is really vitally important. It's all part of their emotional development, and if we can support our children in the right way, we're giving them the tools that they need to get through other difficult situations throughout the rest of their life. This can be a very difficult and challenging time for families, and it's always useful to remember that you're not on your own. There is other help and resources out here for you to support you. Counselling might be something that could be helpful for you as individuals and even as a family. Other resources you might want to consider, but perhaps are quite obvious but maybe don't seem so obvious, is your friends and your family who are around you. What's in your community? It may be your church group or your school or brownies or cubs. Associations like that can be really invaluable at difficult times. They can help maintain a sense of normality in each person's life, but also be there to support and understand that things are difficult and that individual, that child might need additional nurturing or attention.